had they had early intervention and early screening, I dare say they would have lived a lot longer, be alive today. And now with the controversy coming up on mammograms, one of my nieces, now my sister's kids, she's the daughters, because both their mothers died of breast cancer, I some time ago advised, I don't know, I shouldn't say I advised them, I'm not a doctor, but I counseled with them about getting early mammogram screenings because of perhaps some genetic traces or something like that. And so they started at an early age to have mammograms. And so one of them called me up the other day and said, Uncle Tom, what am I supposed to do now? I said, well, I don't know, we'll get the answers. Just yesterday I had a conference call with a number of doctors and nurses and breast cancer survivors in my state of Iowa, and I think the consensus was clear, Senator Mikulski, as you stated in your statement, that there's no confusion, there's no dissension among any of them, but that mammograms were a very useful tool. It's not the cure-all, not the only thing to do, but combined with self-examination and combined with annual physicals, a mammogram can be the key to early detection. And we all know that early detection and early intervention means that a woman's going to live longer and have a quality of life. And so I hope that we can clear up some of this. I just walked in, I'm sorry I'm a little late, Madam Chair, but I just heard you say that we're not here to debate or anything like that. I understand that. But I think we are here to shed some light on these studies. And to shed some light and to find out from the experts and from breast cancer survivors, people who have been involved in this for a long time. I see Fran Visco sitting there. To give us some guidance and direction and to reassure the women of this country of what they should do to protect their health and to make sure they get early screening and early intervention.
I am very pleased to present my first official testimony as the director of the National Cancer Institute, and to do so on the important public health issue of mammography, and to provide guidance on both the scientific and clinical dimensions of this problem, and to also make clear why the National Cancer Institute remains committed to its use of mammography as one tool in our fight against breast cancer. I ask that my full written statement be included in the hearing record. I am joined today by Dr. Peter Greenwald, Director of the National Cancer Institute's Division of Cancer Prevention, and by Dr. Barbara Reimer, Director of our Division of Cancer Control and Population Sciences. These two individuals have worked tirelessly on this issue and have contributed so much to our understanding of early detection strategies. Along with the millions of women threatened by breast cancer, we at the National Cancer Institute are grateful to you. Grateful not only for your addressing this issue today, but for all the effort you have expended in the past to help make more effective early detection and treatment options available to women. As you know all too well, cancer is a complex disease, and our solutions to this menace are likewise complex, but also deliberate. As scientists and clinicians, we examine, we evaluate, we learn, and we intervene. And through it all, we continue to drive forward toward our goal to save lives and to eliminate suffering. This has been the story with our continuing struggle against breast cancer. Many years ago, we embarked on this journey to save the lives of women with breast cancer by detecting the disease early, when we could apply more effective therapy. Our tool initially for early detection was breast examination to detect a lump. And then in the 1960s, X-ray detection using mammography began to be employed, especially in North America and Europe. And from the 1960s to the 1980s, 7 randomized clinical trials that enrolled over 400,000 women were conducted to determine whether mammography, when it was used as a screening tool in women with no symptoms or sign of breast cancer, would then result in decreased mortality from breast cancer. These data have been subsequently analyzed, examined, and re-examined by organizations like the NCI, the American Cancer Society, the American College of Radiology, the U.S. Preventative Services Task Force, and many others. These reviews ultimately led the National Cancer Institute and the American Cancer Society to together issue a recommendation in 1997 that mammography was beneficial to women in saving their lives from breast cancer, beginning with examinations starting at age 40. As you've mentioned, Senators, a recent critique of these major clinical trials has reawakened the debate by casting doubt on the absolute value of mammography. While my written testimony provides more specific details, the bottom line is that the NCI has reviewed this latest analysis, and after careful and serious deliberation, we have concluded that the weight of evidence continues to show that mammography saves lives through early detection, which permits treatment of the disease at an earlier stage. This conclusion is shared by the U.S. Preventative Services Task Force, an independent panel of private sector experts in prevention and primary care that is sponsored by the Agency for Healthcare Research and Quality. Senators, allow me to be clear in my testimony. As the director of the National Cancer Institute, who is also an investigator, a clinician, and a cancer patient, I want to assure you and the women of this nation that we are being vigilant regarding evaluation of all information on early detection of breast cancer, that we are dedicated to continuously improving the diagnosis and treatment of this disease to save lives, and finally to reaffirm the following recommendation that beginning in their 40s, women should be screened for breast cancer with mammography every 1 to 2 years. In my written testimony, I provided you with detailed information regarding our vigilant examination and monitoring of the data, our insights into the debate among the experts, and I enumerated many of the programs that are being sponsored by the National Cancer Institute to improve early detection and treatment of breast cancer. Today, in my oral testimony, I would like to focus on what I believe is the crux of the issue. In this first chart, women of this nation need to know that while we are far from declaring victory, we are headed in the right direction. In the past 10 years, overall mortality rates from breast cancer continue to fall. We first saw this encouraging trend in 1989 with a decreasing death rate of 1.4% per year. More recently, the decrease has sharpened to 3.2% per year. There are significant declines for all ages, and this reduction in death rates has resulted over time in 38,000 saved lives. We have a long way to go, in particular to address the gap between white and black women. But we must ensure that as we go forward, that this downward trend you see here continues. There are multiple factors that can be attributed to this decline. We also need to understand that it is a complex interaction of both the value of early detection, namely the application of mammography, and the application of better therapies that are being developed and applied to women who are diagnosed with breast cancer. This is an equation in which both factors leading to that decline are important. Experts may argue the degree to which one of those factors may or may not be contributing to the outcome. But clearly, both factors are of importance, and both factors must remain in the equation, because without detection, treatment is not possible. We, at the same time, must remember that we have to continue to focus on further downturn in that curve. And in that regard, we must continue to monitor information to determine better methods of early detection. We must, at the same time, contribute to more improved methods of therapy so that together they will result in the most appropriate outcome that you have asked for, namely that we save lives of women with breast cancer.